Most of us think about exercise, nutrition, and sleep when it comes to healthy aging, but there's one critical area we often overlook: spine health. Back pain and degenerative scoliosis can rob older adults of mobility, independence, and quality of life. What if there were simple, proven ways to protect your spine as you age? Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. I am your host, Dr. Jeff Armstrong, an exercise physiologist with a passion for making science simple and life better as we age. My guest is Dr. Terence Verla, neurosurgeon at the Orlando Health Spine Center. Today, we discuss the role of spine health in aging well, the impact of degenerative scoliosis, and the steps you can take right now to protect your back and your independence for the years ahead so you can age well. The Aging Well podcast encourages informed decision-making and always consult your physician and scientific literature when making decisions about your health. Well, Dr. Verla, welcome to the Aging Well podcast. Let's begin by having you just tell us a little bit about yourself and what sparked your interest in the spine, in particular as a neurosurgeon.
Thank you, and thanks for having me on the podcast. I was born and raised in Cameroon, and with the scarcity of resources, it makes you want to do something quite simple. So growing up, just watching men covered in motor oil made me want to be a mechanic. So that desire to be a mechanic is what, mechanic of cars, obviously, that evolved over time. And when I finally graduated from high school and moved to the US, I lived in Minnesota for a little bit, and I discovered being a mechanic in the sub-zero temperature wasn't what I really wanted. So my desire transformed to being an airplane mechanic, which didn't really pan out. So I started researching more of things that I could do to help with my background. And medicine became something I was interested in. So I wanted to be a mechanic of the human body. And that led me to Duke University, where I did my undergraduate degree in biomedical engineering. And during that time, I had a coincidental job at a spine biomechanics lab, studying the mechanics of, injury to the spinal column. And that's what sparked my interest to, doing something spine related. And then the two options now were, well, do you want to do orthopedic surgery and then become a spine surgeon, or do you want to do neurosurgery then become a spine surgeon? But again, with my background, we had a lot of undiagnosed injuries to the brain and spine, which I felt, the neuroscience component was something quite critical. So neurosurgery became the option. And the spine biomechanics part of my undergraduate training is what propelled me into the pathway of spine. And here we are today.
Wow. There couldn't be a better career for, I think, a good mechanic than to be a neurosurgeon of the spine. That's, I think the spine is fascinating. I've taught anatomy in the past. My area is exercise physiology, a little bit of biomechanics, not as much as I'd probably like, but the spine is just fascinating. And so why is the spine, and particularly spine health, such a critical yet often overlooked part of aging well?
So, part of aging is being able to have a meaningful function in life. Spend time with loved ones, spend time with kids, grandkids, if you have them. And the spine is the center of our functional abilities, right? Our ability to walk, to pick up the baby, pick up your cat, walk your dog, right? Things that are meaningful to life. And as we age, unfortunately, arthritis and degeneration of the spine, it's just something natural. And as we age, that process is going on. And that's why it's important, spine health in general, because if not well taken care of, it may compromise our functional abilities, and that could bring down our quality of life and the things that matter to us on a day-to-day basis. It can just be getting out of bed, brushing your teeth, right? Going to the bathroom, going to the fridge. These are the simple things that we don't really pay attention to, but that only works when you have a functional spine. So that's why I think it's quite important as we age.
And you mentioned that it's a natural process. And I think for a lot of our listeners and viewers, they just think, well, I'm in my 60s, I'm in my 70s. Of course, I'm going to have back pain. Of course, I'm going to start to lose some of my height because of the degeneration of the discs in my spine. And so this is all natural. There's nothing I can really do about it. But really, it's not entirely natural. I mean, there's a certain level of decline, but how much decline is really dependent upon us. I think we're going to dive into that a little bit more. But let's start with, what exactly is degenerative scoliosis, and why does it tend to develop after the age of 50?
So as we age, we get arthritis in the spine. The joints in the spine, they overgrow, and some overgrow faster than others, and that creates an asymmetric collapse of the disc, asymmetric shape to the spine if one side grows more than the other. And these are arthritic changes, just age-related degeneration that happen. For some, based on their lifestyle, what they do occupation-wise, the propensity to be one curve versus the other in their natural posture, that may accelerate that asymmetric degeneration. And it is that accelerated process, one side versus the other, that triggers a cascade. It could have started with, just a simple bulging disc, right, that goes untreated, and then that leads to an asymmetric collapse of that particular disc space, and that affects the level above and below that, and that asymmetry becomes that apex of the curve. So, it usually starts with a normal looking spine, right, in the age of 30s and 40s. And then you can gradually see the progression as we age from that asymmetric changes in the arthritis that you have. For some, it's more pronounced than others, but it's as that curve progresses that pretty much that triggers and generates the symptoms that may ultimately require intervention.
So how much of spine health comes down to genetics versus lifestyle choices, like how we carry ourselves posturally, activity level, weight management, and those types of things?
It's hard to put a number because this is not it's not an area that has been studied in that much of a detail to have a statistical meaningful correlate. And a lot of patients, it's hard as well because your dad had it, but then your dad is 85 years old, so it makes it difficult, and no one dives into the okay, well, let's figure out the genetic component. It's rare to find three generations of individuals, right, still living with spine issues, as opposed to things like cancer where you can easily do genetic markers to figure that out. So it's really indeterminate. A lot of times, we see, people that have had a very hardworking background, either did some sort of job or occupation that was very physically demanding, right? That could be a precipitating factor, but again, there's really not a linear correlate, right? Because you can have someone who worked at an oil mill and then another person who worked at an office job. They have the same looking spine. So it makes you wonder, is there really a predisposing factor or is it just bad luck?
Right. Yeah, because I think, kyphosis tends to run in my family a little bit more, but I really don't feel it's genetic per se, because, for my mother, it's just probably more of a lack of activity, probably, a bit more of osteoporosis, not good diet, and those types of things, as opposed to, I'm doomed to have kyphosis. I'm much more aware of it. Being an exercise physiologist, also the tendency to be, because I'm 6'5" and talking to people smaller than me, there's that tendency to kind of lean into them.
Yeah.
Being on phones and computers a lot more. So I'm much more focused on maintaining the musculature that's going to keep my posture more upright. And so, in the end, is it going to be my lifestyle or is it going to be genetics that might affect where I'm at? Now I'm 6'5" still. I have not lost any height at 62. So I'm hoping that I've averted that a little bit. But what other lifestyle habits put people at greater risk for back problems as they age? Mentioned kind of computers.
I think you kind of hit it right there in the head, right? Posture. That's a big thing. I'll share this with you. I got stuck in an elevator one day with a physical therapist. And she turned around and looked at me. She was like, your posture is really bad. I was like, okay, I'm sorry. And then she found that I'm a neurosurgeon. She was like, you should know this. And that just speaks for, we think we have a good posture, but we really don't. Like a lot of people really don't. And it's that postural awareness that helps with the structural stability of the spine. Because if we're always tilted forward, that's stressing the muscles in the back. And if those muscles get weak enough, then your spine is just in that position. Right. So that's one thing that I feel like a lot of people don't pay attention to. And then lifting, right? How we lift things. It's very rare to find someone who, can live their life without lifting. So we're bound to lift furniture at home. We, go to the gym, we lift weights, and, bad lifting habits, right, creates an unnecessary stress and force on the spine, accelerates that arthritis, accelerates that degeneration. And the tendency now is you have back pain. When you lean forward, right, you feel better. So you just keep leaning forward and the kyphotic curve keeps getting worse. And, last thing is just diet, right? Diet that can strengthen your bone quality, calcium, vitamin D, preventing osteoporosis. Because one of the things that can precipitate a kyphotic curve is just fractures in the spine, right? As we fracture the anterior end plate of the spine, the front of the vertebrae, that collapses. And as it collapses, it keeps tilting us forward. And when one collapses, it puts the pressure on the one above and below. So as that collapse precipitates, it just makes things worse. So, when you combine the posture, bad lifting habits, bad bone quality, it just leads you down the road.
Yeah, it seems like a bit of a, downward spiral as you start to age, that, our posture gets bad. So our balance gets bad. Our balance is getting worse. So we move less, the balance, our back gets worse, and it just gets worse and worse and worse and worse. So what are some early warning signs that people should watch for before back problems really become serious? And I would say probably anytime you start having a back problem, it's serious. I don't know if there's a level of threshold of seriousness with back injuries, but what are the warning signs?
So the isolated back pain is quite common, right? When I do a long surgery, my back hurts. So that's quite common, and it's very prevalent within the population based on level of exertion. But when you start having radicular pain, numbness, or tingling down your legs, right? Or if we talk about the cervical spine, same thing. Isolated neck problems, okay. When pain, numbness, and tingling are shooting down your arms, or when you feel weakness, that's really a red flag. Like, seek medical help, as soon as possible. But if there's an inciting event, right? If you do something and it immediately generates new onset back pain. For younger adults, it's okay to wait it out, rest, ice, do some massage in that area and see what happens. But the older we get, we probably should seek medical attention because this could be a fracture, right? So isolated back pain, in as much as it resolves in some, you should probably seek help if you're in the elderly cohort. But even in the younger folks, if it persists for more than, I can just say a week, right? If you rest for a week and it doesn't get better, the easiest thing to do is to at least talk to your primary care provider or go to an urgent care. Or you can always get a simple x-ray of your back to make sure there's nothing disastrous. And if there's anything concerning at all, then that's usually when a consultation to either a spine center or neurosurgery office is necessary. Because some of these things could start rather small, right? Something that could require a rather minimally invasive outpatient procedure. You wait 4 or 5 years, and now we're talking about a big complex surgery that keeps you in the hospital for a week.
And some of us have pretty high pain thresholds, so sometimes we kind of push through those things. It doesn't seem so bad, and then we get used to it. And so what really is bad just keeps getting worse and worse, and we're not really kind of perceptive of it. Would that be correct?
I mean, that's very correct. And we see that a lot, right? And in as much as I work in a hospital, I hate going to hospital, right? But I would say it's good to know what you have. I see a lot of patients. I see more patients in my office that don't need surgery, that need just counseling, than the people that directly need surgery. And the reason being, it's nice to get it looked at. Right? Understand what you have, get educated on what you have, and get notified of the red flags. If you don't know what you have, then you really don't know what the red flags are. You don't know whether this episode of urinary incontinence is a sign of spinal cord damage, or is this episode just because you were tired, right? But the more you know, the more you can essentially care for yourself and seek immediate help when that time comes. So I think the education is actually key.
And sometimes you have a physical therapist that points things out to you. And so when you were in that elevator, what changes did that prompt for you? How can exercise, mobility training, and those types of things help protect the spine as we get older? What did you start doing once that physical therapist said, hey, stand up straight?
The first thing I did is when I'm at the sink doing dishes, I don't lean over, right? Because it's interesting. Like every time I did dishes, my back would hurt. And I was like, well, that's why, right? I was standing the wrong way. And it's the same thing. So ever since that encounter, the way I stand in the operating room, the way I sit in the office, the way I carry myself around, I find myself sometimes doing that, like hunching over, and I have to just readjust and reassess my posture because I've seen a direct correlate with whether my back hurts at the end of the day or doesn't. So it's helped me, and I tell everyone there's no one that doesn't need physical therapy, right? Everyone could benefit from it one way or the other.
If you're enjoying the Aging Well podcast, be sure to like, subscribe, or follow on your favorite platform so you will never miss an episode. And if you find our conversations helpful, please share the podcast with a friend because aging is something we're all doing and we're better at doing it together. And support our guests in this podcast financially by visiting the affiliate links in the episode description below and use the links or codes provided for discounts on products we have vetted and feel comfortable recommending to our valued viewers and listeners. Thank you. And now back to the podcast. So did you change your posture and how you do surgeries as well? Because I would imagine in a long neurosurgery on the spine, you're hunched over. You have to be in order to kind of get in there close and do all that detailed surgery. So what do you do different?
So I've actually embraced technology in preventing me from being hunched over. There's some things you have to look, right? But, we have all this 3D microscope and cameras that rather than you leaning over and looking at the spine, you can maintain a neutral posture and put the camera down and then just look at a 65-inch 3D TV, right? And see everything in magnification and finer detail. So, during my training, it was all looking down, right? There was some camera activity going on, but there was a lot of looking down. And for the big complex surgeries, unfortunately, sometimes you have to look down. But even in those cases, I take breaks, right? I would do something and just look up, stretch my neck, right? Look up and down, and just get my shoulder muscles relaxed and get myself kind of reset. And, I've found that actually gives me enough strength to do more and quicker and safer rather than to just keep going and then my neck just keeps hurting. So I actually take breaks just to stretch and strengthen the muscles in the back of my neck, and then I get back to work.
So you said everybody needs physical therapy. So what exercises, mobility training do you recommend for those of us who would like to maintain our health, our spinal health?
I think it's one, knowing how to maintain good posture, right? I'd always start with that. Stretching exercises, stretching techniques, learning how to relax your muscles. Because one of the other things that could propel arthritis and, scoliotic curves and kyphotic curves is asymmetric muscle strength, right? If the paraspinal muscles on one side are stronger than the other because of just your physiology, that can actually create that asymmetry in the way your arthritis develops. So just stretching exercises, good, functional, life and how to get up from sitting, getting out of bed, especially as we age, right? Now we have knee problems, ankle problems, shoulder problems, things that are not really spine related, but can now influence how we get around. So it's not just physical therapy for the spine, it's also physical therapy for the other joints because everything is connected to the skeletal system, right? So it's learning how to function as a whole, right? You could have knee surgery, right? Do not underlook the importance of physical therapy after that because it also affects your spine health, right? That knee, everything gets connected to the pelvis, which is now connected to the sacrum. The sacroiliac joint gets degenerated. Then the lumbosacral region gets degenerated, and it all started with your knee. So every, from a holistic approach, every part of the body has to be in synchrony. Otherwise, it just creates this cascade that affects the next.
And one thing I teach my students is, we often talk about core exercises for the spine. And most people think, oh, okay, I'm going to do my ab exercises. I do my crunches, maybe some oblique exercises. But I teach that, really the core is the spinal line. All those muscles and that fascia that run from the occipital bone all the way down through the spine, around the hip, around the knee, down to the ankle, comes circles kind of like a stirrup around the foot, and then comes back up and then ends up on the other side. If any of those muscles are out of alignment, it's going to progressively lead to what you're talking about.
Correct.
So what role do nutrition and weight management play in supporting a healthy back?
So I go back to mechanics, right? Where is your center of gravity? When we stand up, you want your center of gravity to run right through the pelvis. So as we gain weight, it's usually very asymmetric, and it's usually more anterior based. As that happens, right, the center of gravity shifts, and as it shifts, your spine now wants to rotate forward. As it's rotating forward, the muscles in the back want to pull it backwards. So those muscles are hurting. They're getting tired out. They're getting fatigued, and they're spasming. So now you have back pain, which could be improved by just getting rid of the anterior weight that you've now developed. So weight actually shifts your center of gravity, right, and that can accelerate your back pain. The other thing now is you're having weight on the actual spinal column, right? Each vertebrae, the joints, and the disc are now experiencing more weight than they should. And that leads to accelerated degeneration of the disc, accelerated arthritic changes throughout your joints from essentially top to bottom. And you see that quite prevalent in the lower aspect of the lumbar spine, right, which is what carries all that weight. And then the weight, one of the things that I actually find to be a precipitating factor is it affects your other joints that are not even spine related. I see a lot of patients, they come to me with, they've gained a lot of weight, and then a little bit of back pain they had is now worse because they had ankle pain and knee pain. They end up requiring a knee replacement, but then that knee pain is what made their posture worse, and then they gain more weight, and then now their back really hurts. Right. So the weight can be other things that now precipitate the spine problem. And, nutrition, I think it's critical for two things. One, it helps with the weight, right? And then two, it helps with just the overall quality of your cartilage, the connective tissue, and your bone health. Because osteoporosis and osteopenia, that's a really confounding variable that can deteriorate your spine health, quite rapidly. So I think having a proper nutritional aspect of your diet, and obviously checking your bone health early on, right? Not waiting till you're 85 to find out you have osteoporosis, osteopenia, but at least knowing early on what your calcium and vitamin D levels are, and whether you're at risk for some of these bone health related complaints.
Yeah, I think a lot of women don't realize that they can prevent osteoporosis, or at least limit it, by simply just being physically active and eating a healthy diet when they're younger, pre-menses, really building up that bone mineral density so they have more to lose as time goes on. So if somebody is already experiencing back pain, what are the first steps they should take before considering surgery?
So the first thing is knowing what's causing it, right? Because that's pretty much the first point of separation. If you're having back pain and there is no, pathologic features on an X-ray, CT, and MRI, then typically we can attribute that to just, musculoskeletal. It's not, at least there's not a deep cause. There's not anything that requires surgery. So I think that's the first point that gives people peace of mind, knowing that there's nothing deeper, right? And we can figure out how to control the pain by, either massage therapy, physical therapy, or just trigger point injections. But now, once we identify what's causing it, let's say you're having back pain because of a fracture or bulging disc or degeneration in the spine, usually before surgery is the absolute recommendation. I think conservative treatment options are things that really work. And that starts with physical therapy, right? The option is do nothing, which no one wants because obviously your back hurts. That's why you're here. But, physical therapy and occupational therapy, and I think these are two essentially zero risk options, right? It only provides benefit. There's no harm to you. It can only help you. So when you look at the risk benefit profile, that's like the biggest benefit you can get from any therapeutic intervention we can recommend. So I usually start with physical therapy. Let's just try that and strengthen your core, like you mentioned, and get you, more flexible and relax some of that muscles and figure out whether we can help you without any sort of surgical intervention. And if that doesn't help, some of the other non-invasive things we can do is just with pain management, right? Whether it is an injection or radio frequency ablation or any other pain interventional therapeutic modalities that they have. These are outpatient, low risk things that I've seen people have dramatic response, right? Years go by and they don't really need me at all. And it's only when those things don't work that I tell patients, hey, we should probably consider surgery. And while the problem is still small, rather than wait till later on when you're more incapacitated before we consider doing something else. And as technology has improved, things like neuromodulation type therapies have actually come to be, right? Spinal cord stimulators. These are things that I've seen patients that require surgery are not a surgical candidate because of bone quality, age, and other medical comorbidities. And some of these, neuromodulation type techniques have actually taken care of their pain, and they didn't really need to have surgery. So there are options, but those options can really be entertained once we know what the problem is. Because if we don't know, we really can't help.
Right. And so how can early detection and intervention prevent or rather improve the long-term outcomes for people who are at risk for degenerative scoliosis?
I think, if you look at, I'll just use an example of a patient that I've seen. You have a small herniated disc, right, at one level, which if you do a minimally invasive outpatient surgery to remove that disc and take out that leg pain, pretty much return to your normal life, right? Now, that disc wasn't done. It wasn't addressed. So the patient kept, limping on one leg, and that progressed, right? And now it led to an asymmetric collapse of one segment in the lumbar spine. And then that accelerated the degeneration above and below. And now, instead of a neutral spine, we're dealing with almost a 50-degree coronal curve, which all started with one herniated disc. So the reason why early detection matters is because I think if there's a small problem that is identified early on, the solution can be something quite small and quite minimally invasive, right? That can return you to function in less than a few weeks to a month. As we wait and as we ignore that, one segment of the spine that is compromised directly affects the functionality and the flexibility of the level above and below. So the adjacent segment degeneration goes up once a segment is compromised. And that's one thing I try to educate patients on, that we shouldn't ignore the problem we have, because that problem will create a cascade above and below that. And we see that a lot in the cervical spine, in the lumbar spine, and patients come with old MRIs, right? It was just a bulging disc at C4-5. Well, fast forward 5 years later, we have a bulging disc now at 3-4 and at 5-6. So instead of having, a one level problem, now we're dealing with a 3-4 level problem. So it's good to identify it early, discuss the options, and know what interventions can be done.
So in our preventative care, what are some steps that we can take to identify the problem before it's a problem? Because I don't think in preventative care we really think about, unless we have the pain, nobody goes to their doctor, or I've never had a doctor that says, hey, okay, let's kind of look at your spine and let's, see if there's any issues. What are some things that we can be doing?
I think the spine, I say the spine talks to us, right? The spine will tell you what's going on. If you have zero back pain, zero neck pain, you're fine, you get up in the morning, you go to work, there's really no need to open up that Pandora's box, right, to try to see what you don't have. I think things like the curvature of your back is something simple that should and can be assessed. It doesn't really need to be assessed by your primary care doctor. I think just at home, right, your spouse or your partner or your siblings or anyone, your roommate, whoever can just look at your back and figure out, is there a curvature? Is your scapula blade, right, asymmetric? Just simple things that you can look at to tell you what your alignment is, right? But even then, it opens up that question of, well, does everyone need scans and images if they're asymptomatic? And I think they don't, right? Unless you actually have a really bad curvature, and getting all the necessary scans and having you talk to a surgeon, again, is for education rather than surgical recommendation. But without any, physical deformity, and without any pain, numbness, tingling, weakness, or bowel bladder issues, there really isn't any need for, preventative imaging to look at what you don't have. Because for recommendations are pretty much made on what I call clinical radiographic correlate, right? If you have a problem and it matches what we see on the films, we fix, right? If you have a problem and it doesn't match, well, we just have to educate you on what could happen if this thing that doesn't present symptoms now present later. But in our day-to-day life and day-to-day health, I don't think there's anything you can do for an asymptomatic individual besides just live a good life, right? But when the symptoms start to develop, I strongly believe that, people need to have it looked at, right? Access for us is a big deal, right? Especially here, we try to create as much opening and entry points for patients that have pain or any worrisome spinal pathology. Because the easier they can get to us, the easier they can know what's going on so we can put them on the right path. But if you're in a community or environment without access, then it could take you 6 to 9 months to see someone in a spine clinic. And those 6 to 9 months, the problem you had 9 months ago is now 10 times worse. But now we offer options where, if a patient needs to see anyone in a spine clinic, right, within pretty much 24 to 48 hours, we can get you in, take a look at the problem, get all the necessary x-rays, and pretty much point you in the right direction.
As somebody who trains exercise physiologists and pre-physical therapy and pre-occupational therapy students, I like to try and get my students to develop those psychic skills that they can, as they're training somebody, the way you're squatting or the way you're moving, if you continue to move in that pattern, you're going to develop problems. So how do we correct those movement patterns? Incorporate the biomechanics and the understanding of this spinal system to get people moving. And first of all, just getting people moving, I think, is one of the most preventative things that we can do to kind of limit your workload, is just getting people moving, but then getting them moving correctly and then correcting the incorrect movement patterns. And I think that is some of the best preventative stuff that we can do. But even people that are exercising regularly are going to experience back pain. Sometimes it's just, that genetic predisposition. And when people do start to experience back pain, that is usually that time where I got to stop exercising. I got to, not exercise because my back's aggravated. And so many people hesitate to stay active because of back pain. How do you help patients maintain quality of life while we're addressing these spinal issues?
That's a tough one, because they're coming to you because of disabling pain, and it's usually, again, like, is there a surgical pathology or not, right? If there's none, it's very difficult to explain how you return to function, right? Because there's not a bulging disc, there's not a degeneration in your spine. It's purely musculoskeletal. I think, one, reassuring them, right, that this would too pass, right? So at least there's nothing that needs surgery. But also pointing people in the right direction and offering resources, right? Because I've found that it's not just, go to physical therapy, do massage therapy, but how quickly you get to that point. Because if you're coming to me with 10 out of 10 pain and it's going to take you 6 weeks to start PT, well, what happens in 6 weeks, right? If it's going to take you a month to see pain management, well, what happens then? So I think, as people are having back pain, what, we're doing in our institute here, and what, I've tried to collaborate with other providers, is how do we get them to start the next step quickly, right? How do I get you to PT like next week? How do I get you to pain management maybe in the next 2 days? because it's that immobility, right? It's that constant pain and not having any direct options. This patient ended up going to the ER about 3 more times between your clinic and next month, and that drives healthcare cost up, right? And that puts them at risk of getting some sort of hospital-acquired infection. And it's really not a good use of the resource, right? So access is a big thing for the patients that come in with severe pain, and how do we get them back to function? We have to get them in the right place, the right therapy, the right intervention, and do so in a timely fashion that doesn't essentially create this cascade of severe pain at home and seeking for immediate solution.
So for listeners that are in their 40s and 50s, what practical steps can they take now to prevent spine problems decades later?
I think we mentioned the diet, the nutritional component. I think, we all ought to pay strong attention to that, right? Because bone quality, if you think about the skeletal system, right, it's all bones, right? So all the spinal vertebrae, these are all bones. And if the quality of your bone is compromised, then it really affects the extent of the arthritis, the extent of the pathologies that could happen. So that's one thing. The other thing is just, keeping fit, right? From whatever way, shape, or form, whether it is by exercising and doing it well, right? Not trying to bench press more than you can or deadlift more than you can, doing it well, and, stretching, going for a walk, like just keeping yourself physically active. As long as the muscles are being utilized, they're being put in the stretch and relax mode, and you're not stuck in one position. Even if you work in an office job where you're sitting for 12 hours a day, take breaks in between, right? Adjust your posture, make sure you're sitting right. Your office environment, make sure your desk height and everything else is in a way that, you don't develop neck pain or arm pain. And it can be as simple as your mouse, right? I see a lot of patients coming in with pain in their wrists, right? Because of how their mouse pad is. So it's just understanding that as we age, our body's breaking down and it's aging too. So we need to make our environment conform to us, right? And if it doesn't, and if there's something we do that is eliciting discomfort, it usually starts with discomfort, right? Like I get uncomfortable doing this. And then 6 months later, oh yeah, I have severe pain doing that. But most of the time when I go back, it started with discomfort. So, in our 40s or 50s, when we identify the things that cause discomfort, we need to reconform an environment to suit a better physiology and a better wholesomeness. Otherwise, it only triggers a cascade of events that we don't want.
And probably waiting till 40 or 50 is probably not the best time to be addressing those things.
Not.
It's when we're in college maybe, or, we're in school, we're learning, how our parents sit up properly, sit up straight at the table, do all those things. Listen to mom when she tells you to do those things. And that might offset a lot of problems down the road. So I'm to the point of asking the question I ask of all my guests on this podcast, what are you doing personally to age well? I know you're standing up straighter when you do the dishes.
So I try to pay attention to my balance. I try to eat healthy, and make sure that from a daily vitamin standpoint, all the boxes are checked. I try to exercise as much as I could. Sometimes it's limited due to work. If I'm stuck in the OR all day, it gives me little time to do so. But when I do have time, I try to exercise as much as I can. And not to overdo it, but to maintain, right? Cardiovascular health is necessary. Because if you think about it, right, the nutrients get to the rest of your body because your cardiovascular system is strong enough. So the other thing that I think is underlooked in most of medicine is mental stability, right? It plays a role in spine health, because if you think about pain is a perception of the signal that gets to your brain, right? The same trigger, the same bulging disc in two different individuals will generate two different levels of pain. And our mental health plays a role in how we perceive pain. And I think for me, as you asked, I try to create a space where I am mentally fit, mentally capable, not just to take care of my patients, but also to take care of myself, because I know that that is a thing that can influence my overall spine health. How I perceive pain, how I perceive, things that are happening around me, and how that can influence how I react and how I do things. So if there's something I think we underlook and just overlook in general in spine care is how mentally fit is the population, right? For anything at all. What resources do we have to help people with whatever kind of mental health issues, right? Because I know, and I have seen it quite a bit, that the people that have mental health disorders, their response to pain is very different. And even if they have an intervention, the outcome is different because the resources are not there to handle that particular component of their existence. So
That's
I try to be mentally fit every single day, from meditation, right? From, whatever I can do. For me, it's mostly spiritual health, right? That kind of keeps me mentally sane.
That's our SPIES model that we talk about a lot on this podcast, which is the spiritual, physical, intellectual, emotional, and social well-being, and the importance of all those. In fact, in my teaching, I kind of adopted, I've heard several physicians over the last couple of years bring up the phase, medical treatment needs to be not just biological, but or pharmacological or any of that. It has to be biopsychosocial, that we have to consider the mental health, the well-being, and the social connectedness of the individual. And I had one of my former colleagues, was the biomechanist. She brought up, oh no, it's biomechanical psychosocial. And I'm like, you're absolutely correct there. Because if our psychology, if our mood is bad, it's going to disrupt our posture. People who are depressed don't stand up straight and as confident as other individuals. And that's going to precipitate other back issues. Those back issues could precipitate other digestive issues, breathing issues, diet issues, exercise issues, and it all kind of snowballs. And so really a key factor in there is that mental health and caring for our own well-being. And so I appreciate that you brought that up to our listeners and our viewers. Because a lot of times, I ask that question, it's like, well, I'm, lifting weights 4 days a week and I'm doing cardio 3 days a week and I'm watching my diet, getting more fiber, but not enough of them necessarily say, I'm being attentive to my mental health. Good point made there.
Thank you.
Was there one simple piece of advice you want every listener or viewer to take away about spine health? And if there is, what would that be?
I think the technology has really evolved. And we have the chance and the opportunity to provide good quality outcomes with very minimally invasive technique to get you back to function. A lot of people are scared. It's okay to be scared, right? It's okay to be scared. I think what I do is, I try to educate every single patient the best I can. Let you know what you have. If it's something that I honestly, sincerely, and deeply think that I can help, I offer that option, and I offer all the options, right? Even if it's an option that I cannot do, I have to let you know, because the goal is to help you, every single patient, and to help you the best way I can. What would I do if you were my brother, my sister, or my mom, or my dad, right? I have to figure that out. If there's a technique that I think I would have offered it to my family, but I don't do, then I have to find you someone that can do it. So for everyone out there, there are things that can be done to help you in every shape, way, or form if you have a spinal problem. And don't hesitate to at least seek neurosurgical consultation or a spine surgery consultation, just to at least start with the educational profile. Understand your body, know your outcomes. At that point, you can choose and decide what you want. It's the basis of informed consent, right? What we do is, help you understand what you have, but technology has advanced tremendously in a way that there's so much that we can do to help that doesn't involve a big complex operation. So many simple, minimally invasive things can be done.
Where can our listeners and viewers learn more about your work or connect with the Orlando Health Spine Center?
So one of the easiest ways is you can look me up online. right? But my office is here downtown at the Neuroscience Institute. There's you can look us up through the Orlando Health Neurosurgery Group website. But your primary care provider, the simplest way to get into a spine center or spine clinic is just there's a hotline number which we can provide. You can just call that number, or your primary care provider can just put in a referral to the spine clinic, and there's a triage, right, that gets you there within 24 to 48 hours, right? You get paired into a clinic where you can immediately see either a PA or a physician based on the severity of the problem. But I'm with a large group of neurosurgeons here downtown at the Neuroscience Institute, and we cover pretty much a complex array of neurosurgery, right? From complex brain aneurysms to brain tumors to all sorts of spinal pathology, spinal cord tumor, spine fractures, degenerative spine, scoliosis. So these are all things that we cover. I personally cover the full spectrum of spine. So, for every listener out there who essentially has any sort of spinal problem, I should be willing and able to help or point you in the right direction.
And so if they're going to need that spinal surgery, you can bring the family down to Disney or to Universal. They can go do all that while you're being cared for by the very capable staff at the Orlando Health Spine Center, correct?
Correct.
All right. Was there anything we neglected to talk about today that you wanted to make sure that our viewers and listeners hear?
I think we covered pretty much everything, and I just want to say thank you for the opportunity. And for all those listening, there's so much more we can do, and there's so much you can learn from a consultation with us, so we can review your spinal anatomy concerns.
Well, I thank you for coming on today. I do hope that ultimately our listeners are doing everything they need to do to not have to see you, but it's inevitable at some point. Not everybody, but people are going to have back issues, whether they try and prepare against them or not. And so if they do, there are people like yourself that are doing wonderful things to help fix them so that they can get back to aging well. Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.